remember every paediatric cardiac arrest I've dealt with, and they all leave a mark on you. You remember them forever because they're unique jobs, they're very uncommon jobs, and to be able to deal with them in a professional manner, especially to get a good outcome, they're very rarely a good outcome case. Paediatric cardiac arrests generally occur because the child's so gravely ill that there's very little chance of their survival. And to take a patient into hospital with a return of spontaneous circulation is also testament to the quality of advice that was provided. Well, I can remember the FANIC call that Karly dealt with in the Emergency Operations Centre because I was actually working on operation shift at the time and I was sent to the call. I didn't actually arrive on the call because the crew managed to pick up and go to hospital quite quickly, which is absolutely the right thing to do in those circumstances. But I do recall that it was a baby who had stopped breathing, and I know from the CAD notes that Karly had given some CPR advice, and actually just as the crew had arrived, the baby started making noises, started crying and gurgling and things again. And I've read from the CAD notes that once the crew had arrived and started conveying the patient to hospital, there was actually an excellent cardiac output with a good heart rate, and the baby had started to stabilise. I can't imagine anything more frustrating than being on the end of the telephone, not being able to actually touch the patient, not being able to actually try and improve the situation that you're faced with, having to try and do everything through a terrified father or mother perhaps. And I think what Karly did on the day that she did, to deal with that on 2 occasions, is pretty epic. The fact that she carried on through her shift afterwards and it was all taken in a very matter-of-course attitude is just testament to her professionalism and the job that she comes to work to do.